What is the differential diagnosis for patellofemoral pain syndrome? So, patellofemoral pain is a diagnosis of exclusion. And what that means is you want to rule out other pathologies. And once you've ruled everything else out, if you have some sort of anterior knee pain, we can surmise that this is some sort of patellofemoral issue. Okay. Now, here's the other thing, you can have patellofemoral injury that's not patellofemoral pain syndrome. So the first one's going to be patellofemoral osteoarthritis. So if I'm over the age of 40 and I have some sort of radiographic evidence of less cartilage within the patellofemoral joint, usually on the lateral side of the joint, okay? If I have a different position of my patella now, just because I've had more wear on the outside of my joint over the course of time, you would diagnose this as patellofemoral osteoarthritis, which might be a little different in the way you treat than patellofemoral pain. You could be also dealing with some sort of cartilage issue within the patellofemoral joint that is traumatic in nature. And usually they tease that out via subjective history. Okay. Could be dealing with some Syndig-Larsen-Johansson disease, Osgood-Schlatter disease, patellar or quad tendinopathy. And all of these conditions can usually be teased out via palpation and where exactly the pain is. Okay. Either superior or inferior to the patella. Usually patellofemoral pain is behind the patella or on the inside or outside of the patellofemoral joint. There could be some sort of trauma. So if I twisted my knee playing soccer, especially if there's a lot of swelling present, you're going to start ruling out patellofemoral pain. Okay. You can actually bang your kneecap pretty well and create some patellofemoral pain. That can certainly be a mechanism of injury. If you hit it hard enough, there's a chance you fracture your patella. So you have to be on the lookout for that. And lastly, you want to try to rule out tibial-femoral joint pathology. I normally do this via assessing joint line tenderness, which is typically a very sensitive test. So if I palpate around the sides of the joint, it's a good chance there is not a meniscus issue I'm dealing with. Usually there's no pain or limitation with end range flexion or extension with patellofemoral pain, especially when you're not weight bearing. So it usually is very limited in flexion if you're weight bearing. So if I ask you to do a pistol squat, you're not going to be able to go very far with the patellofemoral pain. But if I passively take you in end range flexion, there shouldn't be a limitation if you're dealing with patellofemoral issues. If there is swelling, it should be minimal. If you have a lot of swelling, I'm thinking more ligamentous issues. I'm thinking more meniscus pathology. You should have negative ligamentous testing, and then you should have negative history of trauma. Okay. Usually this is an overuse issue. And if there's something traumatic that led to this problem, it's probably not patellofemoral pain. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay. So a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain Free Mini Course. Definitely check this out.